types of C-section shelves I want to talk to you about. The first one is a brand new one, so in the first few weeks after for the brand new one, two types of C-section shelves I want to talk to you about. The first one is a brand new one, so in the first few weeks after surgery, and the other one is years postpartum. Two different treatments. First one, for the brand new one, it's caused by inflammation or swelling after surgery and a brand new tight scar. So the solution, honestly, compression. Compression makes a huge difference in the earliest days, so get that compression on ASAP. The second part about an early C-section shelf is scar massage. So at that 6-week mark or whenever you're discharged by your doctor, start that scar massage so it loosens up that tight scar tissue and keeps it from getting stuck down. Now, if you're more than a year post cesarean, there are different causes, actually, more than just two that I've listed. So download this free resource below. You want to find out the cause of your C-section shelf before you can determine what the solution is. Let's keep talking about that C-section shelf. So abdominal wraps, if you use that as soon as you feel comfortable, as in day one, totally do it. The sooner you can control that swelling after surgery, the better. So to answer this question, start right away. Now, how long do you wear your ab wrap and compression garments for is a different question. So after a vaginal birth, keep that on for 2 weeks or so, but then start to wean it off afterwards. But after cesarean, first 6 weeks actually makes a huge difference. Now, everybody's different. So some people feel better after 4 weeks after cesarean using their compression garments. Some people need longer than that. But definitely by the 3-month mark, make sure you're not wearing any compression whatsoever. Okay. Using an ab wrap won't itself cause infection. However, if you're having a challenge keeping the area clean and dry, then that can be a little bit of an issue. So what I always recommend are high-waisted underwear underneath your ab wrap. And if you need to, honestly, here's a really great hack. Stick a maxi pad on the inside of your high-waisted underwear, and that sops up any kind of moisture that you may have. It's summertime, it gets pretty hot. And also if you have an extra fold of skin, if you're a plus size mom, this can be very, very helpful. So clean, dry, wound, no infection. There's no hard and fast rule medically for the amount of time you need to wait between pregnancies if you're having 2 cesareans. That being said, generally physicians suggest that there should be an 18-month wait between the birth of 2 babies because the second birth could very well be cesarean. Now, VBACs, or vaginal birth after cesarean, happens for so many different reasons. I actually ran a phenomenal workshop with She Found Motherhood, the doctors at She Found Motherhood. I'm going to link them below. They are a fantastic resource. Another great VBAC resource are the folks at the VBAC link. So lots of information on both of those accounts, and I'll link them both here. Rehabilitation after cesarean, emergency or planned, starts on day 1. There are actually so many things that you can do. I shouldn't say so many. There are like a handful of things that you want to do. Belly breathing, arm movements, getting in and out of your bed, eventually walking out of your room, gentle walking. Honestly, to name a few, these will make a massive difference in your recovery. So I'm going to link the free resource down below that's called Don't Wait, literally, because you want to start rehab on day 1. And these are some of the exercises that you want to consider. your physician will suggest that you don't lift anything heavier than your baby for the first 6 weeks. Now, that being said, using a baby carrier, that's lifting your baby, right? Except it's a little bit more like a workout. So this question is actually a workout question, and my answer is a workout answer. And the answer is, you want to make sure that you have a solid core foundation first. I call them your ABCs, and that stands for alignment, breathing, core control, right? A, B, C. It is a very standard concept that if you can kind of imprint into your new non-pregnant body and move in that method just throughout your daily activities, applying it to your rehab exercises, but also to baby carrying, if you can do your ABCs, then you're ready. Let's talk about the 4 phases of recovery, and then you'll understand my answer to this question. Okay? First of all, most people assume, well, if I'm weak, like after an injury, like a cesarean birth, I should get stronger. And the way to do stronger is to do exercises like planks and yoga. That's actually phase 3 of recovery. Phase 1 is, can I connect my brain to the muscles that have been cut, right? In this case, transverse abdominis. Can you engage your core? Phase 2. Can I repattern those muscles? Fancy word for saying, can I get muscles to work together? Right? So can your transverse abdominis work with your breathing, work with your pelvic floor? Can they synergize when you're moving, like walking? Okay? And that's what rehab is. It's a whole series of different exercises you can do. Stage 3 is strengthening. Stage 4 is sports. So there's your answer. No, it's not too late 6 months postpartum. Get started right now, actually, because you're kind of on the cusp of a critical healing phase. What does that mean? Your scar tissue gets harder and harder to manipulate and change with your own hands at around the 6-month mark. Okay, that doesn't mean you can't change it. It's just, in general, it gets harder to change the longer you wait. So, scar massage, 1 scar massage every day, 1 movement or exercise every day, right? The exercises I talked about in the previous screen. So that's 5 minutes every day. You want to progress those as the days, weeks, and months go by. And if you're not sure what to do, you follow a program. I happen to have a cesarean recovery program, so you can follow mine. You can try to figure it out on your own, but the best option is to follow a program. It takes the guesswork out of it, and the results will be yours. So here's another option. If you don't want to do it yourself, like the program I just mentioned here, and you'd rather do your cesarean recovery with me, one-on-one, and intensive for 3 months, then the Concierge Cesarean Recovery Program is for you. And what's really cool is 2 spots just opened up for immediate onboarding. So that means if you want to sign up now, you will literally start your rehab this week. So I'm going to link the information below. Getting into this program is by application only. I want to really make sure that this is the program that will meet all of your needs, and kind of selfishly too, I want to work with someone who will be doing the work, who will do their rehab every single day, who will ask questions, who want to push themselves. So that's the Concierge Program. Info below.
Good morning.